Hi, my name is Dr. Robin Abramzig, and I'm a holistic dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here with my friend Deirdre Cannon, and she is a lactation consultant. Deirdre, would you share with our audience a little bit about what you do?
Like she said, I'm a lactation consultant. I'm with For Baby's Sake. We typically cover the Tarrant County area of North Texas and some of the surrounding areas. One of the large things that we deal with is a lot of tongue-tied babies, which is why I'm here with you.
Absolutely, and thank you so much for joining us. So I would like for Deirdre to share with you a little bit about what a mom and dad can expect after a tongue and or lip tie is released.
Typically, you're going to have some form of pain management. I like to recommend homeopathic medicine. We have a blend that we typically use. You can order it from online, or you can mix it yourself. But homeopathy works with the baby to kind of help with that trauma and the kind of calming and the healing and the inflammation. So that's what I typically like to recommend, and our babies have done really, really well with that. Some of our moms prefer to go the more traditional route with Tylenol, and for that we always say, speak with your pediatrician about dosages. But for the most part, a lot of our moms do use the homeopathy, and they really find that that's helpful. Definitely have a plan for pain management, though.
Yes, absolutely. So another question that moms have is their baby's fussy and they won't eat. So can you talk a little bit about that? What's normal? How long would they expect to be fussy?
Most of the time, and every baby handles it differently, there will be babies that just sail through it and you will wonder, did we actually do a tongue tie surgery? And then there will be babies that handle it much differently, and they're very fussy and very frustrated, and they may either shut down and sleep a lot because that's kind of their way to heal, or they may cry a lot after the surgery. One of the things we really like about the homeopathy is that you can give doses of it continuously every 15 minutes until baby calms down, unlike Tylenol that you can only give once every 4 to 6 hours, and that's it. Every now and again we do have a baby that goes on a little bit of a nursing strike, and they hesitate to eat because they're sore. If your back hurts, you protect the soreness by not moving. If your tongue hurts, you protect the soreness by not eating. Most of the time what we encourage moms to do is change the environment. Go walk outside or crawl in the bathtub with baby and do a lot of skin-to-skin nurturing in the water. That can really make a difference. Most of the time they'll eat right after the surgery, and then later when the topical anesthetic wears off is when we see babies that are like, what just happened? It's not uncommon in the first 24 hours for babies to be a little hesitant to eat. If baby absolutely won't latch on and nurse, then we would encourage you to use a dropper or a bottle or something to get some fluid into baby so that they stay nice and hydrated.
And that's okay.
And that is okay. It rarely lasts that a baby will strike longer than most of the time 6 to 8 hours at most, but occasionally I've had a baby go 24 hours. They do come around as the soreness starts wearing off and as we get that under control. Lots of skin to skin. That really makes a big difference.
That's great. So some babies are fussy, not at all. Some babies are fussy. Most of the ones that I see are fussy for a couple of days, but sometimes I've even seen them fussy for 5 days.
Yes. The average, I would say, is expect your baby to not be themselves for at least 3 to 4 days. The first 24 hours is the most intense, but after that it gets better with every feeding and with every hour that passes.
Absolutely. So in order to set a baby up for success, there needs to be a good release. What other integrative ideas do you have on how to make the baby more successful, to have a long breastfeeding relationship with mom?
I really find that most of these babies need some good body work. Very rarely do I have a baby that I don't feel like would benefit from body work. Sometimes that body work is chiropractic, but oftentimes when we're talking about tongue tie issues, it's actually more in the family of osteopathic body work or cranial sacral body work. When they nurse for a certain way for a long time, they kind of overdevelop the wrong muscles and underdevelop the correct muscles. And with overdeveloping, they get tight, and we need to loosen up that tension. So most of these babies really, really need some body work. I encourage moms to take baby in for Bodywork before the surgery so that then you or whoever the practitioner is can really get to the entire frenum.
Absolutely.
And then I encourage them to follow up with at least a couple of sessions of Bodywork after the frenectomy, because during the healing process they will kind of tighten up and protect themselves a little bit, and we want to loosen all of that
Absolutely.
up and help with the healing.
Wonderful. And then also the other part would be working with a lactation consultant such as yourself that is very familiar with frenectomies.
Absolutely. A lot of, I find in the Facebook age, a lot of moms find these tongue ties on their own. Maybe their pediatrician missed it, or maybe their pediatrician was the one that caught it and sent them to the dentist, but then there's nothing else. That's just it. You see the dentist and you expect it to be all better, and it's not all better. I kind of say that the tongue tie is the framework of the puzzle. When we correct the tongue tie, we get the biggest part of the picture put together, but that whole center still has to be worked on to get the best results. You need somebody like a lactation consultant that you can call when you're having a panic attack because your baby won't latch on a nurse, that can walk you through some of the things that we can do to get baby back on, and then how to improve nursing after, because it's not an immediate fix. They have to strengthen that tongue muscle that's never been used, and there's a lot of suck training exercises that we can walk you through, making sure that you're doing the stretches so that we don't have reattachment correctly. You need somebody that you can contact, because the dentist doesn't necessarily know all the ins and outs of the breastfeeding relationship, and they don't know how to answer your questions, and so that's when you can call your lactation consultant.
Another thing that I see sometimes after the release, the baby may choke or gag because there's so much milk let down, they're not working quite as hard. Talk a little bit about that.
Well, if you've ever had a cast on your leg, when you take the cast off, they usually send you to physical therapy to strengthen that muscle, and it's very similar with tongue ties. We remove the cast by having the frenectomy, but the muscle is not developed, and they don't know how to work that muscle. It's kind of just floppy in their mouth, and they're trying to figure it out. All that milk comes rushing at them, and they don't know what to do with it, so they do choke and gag a lot on it. In the first few days, we don't do a lot to deal with that because we just want baby to heal and feel better. But after 5 to 7 days, probably, we usually start suck training exercises to start working on strengthening that muscle and teaching the tongue to move around in the mouth the way that it's supposed to move around in the mouth to handle that flow.
Absolutely. One last question. Are there any things that moms and dads need to be aware of that they should be concerned about where they would need to seek medical attention?
Absolutely. Anytime that you're concerned about infection, which is extremely rare, talk to your dentist again. They can always review and make sure that there's no signs of infection, or they can handle the situation if there happens to be an infection, but it's extremely, extremely rare. In 5-6 years of working with tongue-tied babies, I've never seen major complications. We've never had major bleeding issues. We've never dealt with infections, etc. So, if there's something you're concerned about, we can always refer you back to the dentist. But there are things that kind of panic moms and dads, like occasionally doing the stretching exercises, you might see a drop or two of blood. That's very normal. But if you don't know that's normal, you kind of, there's blood in my baby's mouth, what did I just do? But very, very normal. So talking to your lactation consultant again, or having a good group of people that have been through this, the breastfeeding support community that have been through this and can say, oh yes, that's very normal, don't panic yet.
Exactly. That's great.
Know what to kind of look for in those situations.
Absolutely. Well, thank you so much for sharing, and we appreciate you joining us today. Thank you.
Appreciate it.